Hello everyone, I'm Apurva. Today I'm going to talk about diabetes. What is diabetes? Diabetes is a condition in which the person urinates very frequently. The word diabetes is derived from the Greek language. In Greek, diabetes means to pass through. So the person who suffers from the condition passes through the urine very frequently. That is the reason diabetes is the name given to this condition. Diabetes is mainly of two types, diabetes insipidus and diabetes mellitus. Now let us discuss about diabetes insipidus. Diabetes insipidus is a condition caused by low levels of vasopressin in the body. Vasopressin is an anti-diuretic hormone, which means it helps in maintaining the body fluids. It helps in preventing loss of fluid from the body. So when this hormone is in less levels in the body, there is excessive loss of fluid from the body. So the person who suffers from diabetes insipidus excessively urinates, but he doesn't lose glucose in his urine, making his urine tasteless. That is the reason this condition is named diabetes insipidus. Insipidus in Greek means tasteless. The second type of diabetes is diabetes mellitus. Diabetes mellitus is a condition in which the person suffers from high blood glucose levels and the person loses glucose in the urine, making the urine sweet. That is the reason this condition is called diabetes mellitus. In Greek, mellitus means sweet. Before understanding what causes diabetes mellitus, let us understand how the blood glucose levels in the body are maintained. Pancreas is a gland in the body which helps in maintaining the blood glucose levels. Pancreas has a set of cells called islets of Langerhans. The islets of Langerhans are again divided into alpha cells and beta cells. Alpha cells of islets of Langerhans produce a hormone called as glucagon. Beta cells of islets of Langerhans produce a hormone called as insulin. Glucagon helps in increasing the blood glucose levels, whereas insulin helps in decreasing the blood glucose levels. These two hormones work in opposite fashion, thus helping maintaining the blood glucose levels. How does insulin help in decreasing the blood glucose levels? Whenever the blood glucose levels are high, insulin signals cells of muscles, fat cells, and liver cells, asking them to uptake the glucose from the blood. As the glucose is uptaken by these cells, the blood glucose levels get lowered. That's how the blood glucose levels are decreased by insulin. Now let us understand the two types of diabetes mellitus. Diabetes mellitus is again divided into two types, type 1 diabetes and type 2 diabetes. Type 1 diabetes is a condition in which the person is unable to produce insulin. Type 2 diabetes is a condition in which the person is able to produce insulin, but the cells cannot uptake the glucose. The cells cannot take the signal from the insulin. Right? Let us now know about type 1 diabetes in detail. So, in this condition, in type 1 diabetes, the cells which produce the insulin are damaged. This damage can either be because of an injury or it can be because of autoimmunity. So, when the cells which produce insulin are damaged, there is no production of insulin. When there is no insulin, there is no signaling to the molecule to the cells which uptake the glucose. So, the blood glucose levels remain high. And in case of type 2 diabetes, there is production of insulin in the body. There is normal levels of insulin produced in the body. But the cells which uptake the glucose from the blood are now unable to take the signal from insulin. And thus, the blood glucose levels remain high. Type 2 diabetes is a lifestyle disorder. And it is usually adult onset diabetes. And type 1 diabetes is a juvenile onset diabetes. Type 1 diabetes cannot be prevented, whereas type 2 diabetes can be prevented. But why? What happens when the blood glucose levels remain high? The thing is, high blood glucose levels can lead to damage of blood vessels. That can lead to increased risk of heart stroke, kidney disease, nerve diseases, etc. And even there can be problem to the vision also, because we have optic nerves, etc., which can be damaged. And type 2 diabetes in the starting stages, that is in the pre-diabetic stages, can be reversed, whereas type 1 diabetes cannot be reversed. The person who suffers from type 1 diabetes usually takes insulin from outside in the form of injections. Right? Let's revise what did we study today. We learned about diabetes, types of diabetes, diabetes insipidus and diabetes mellitus, and what causes diabetes insipidus, and how the blood glucose levels are maintained, types of diabetes mellitus, what causes types of diabetes mellitus, and yes, that's for today. Thank you.